right, good afternoon, everyone. Thank you so much for joining us today. And we wanted to extend a warm welcome and thank you all for joining the LEA BOP documentation training today. And just a reminder, as you enter into our training today, if you wouldn't mind just doing a double check that you're on mute, that would be much appreciated. And we'll go ahead and get our training started today. So before we begin the full training, we'd like to just let you know that the slides were sent out in advance through the LEA BOP listserv this morning. So if you did not receive those slides, feel free to include your name and email in the chat, and an analyst will send them to you. For any questions that come through today, you can utilize the chat by clicking on the chat icon, as you can see at the top of the graphic on the right. And this is on your tools bar, and a chat window will open to the right side where you can type and submit your questions. You can see that chat window graphic here on the bottom of the right slide. And we do have a lot of content to cover today, and the chat will be monitored by DHCS to answer your questions as they come in. If your questions are not addressed during today's meeting, please feel free to send your questions to the LEA inbox and we will get back to you. Also, live transcription is available for those who may need it, which you can find in the More icon in your Teams toolbar, as shown in the graphic here. Click Language and Speech, which will bring up another pop-up where you can click Show Live Captions, and you will be able to view the live captions in the bottom panel of this meeting. Lastly, please feel free to have your cameras on or off, whichever you prefer. The purpose of today's training is to review the basics related to documentation, to gain an understanding of the requirements for proper documentation for LEA BOP, to understand requirements related to documentation of moment responses, to ensure your LEA is compliant and audit ready, and to help LEAs protect and keep their funding. We know LEAs juggle multiple priorities, so this training is designed to make documentation easier, clearer, and audit ready. And so here's our agenda for the training today. Section 1 will be an overview of documentation requirements. Section 2 will go over authorization requirements. And Section 3 will talk about documentation requirements for direct service practitioners. Section 4 will look at some direct service moment examples. And also another list of helpful acronyms that we'll be using throughout our training today. And with that, I'll go ahead and hand over to Dana, who will present Section 1.
Thank you, Sherry. In this section, we will start with an overview of documentation requirements. First, we will discuss why documentation is required. Under the LEA BOP, LEAs receive federal financial participation, also referred to as federal funding, for providing covered services to students who are enrolled in Medi-Cal. Because Medicaid is a state and federal partnership, LEA BOP must certify that funds used to draw down federal dollars meet certain federal requirements. For LEA BOP, DHCS is the oversight agency and confirms that costs are eligible for federal funding. Any claim for federal funding must be supported by documentation that allows DHCS and CMS to verify the expenditures related to the claim. It is required that each provider shall keep, maintain, and have readily retrievable such records as they are necessary to fully disclose the type and extent of services provided to the Medi-Cal beneficiary. It is important to always remember that if states are found to be out of compliance with documentation requirements, CMS may withhold or recover federal funds, which has the potential to financially impact LEAs. We have provided links on this slide to the Code of Federal Regulations regarding these requirements for your reference, and we'll provide them again at the end of this training as well. Over the next 2 slides, we will review some general concepts related to documenting services billed to LEA BOP. The general principle is that LEAs are responsible for ensuring proper billing of services and maintaining adequate documentation to support their claim for federal funds. Proper documentation ensures your LEA receives and keeps the funding it deserves. The LEA is responsible party to ensure that records are maintained to support services billed. LEAs must ensure that any practitioner they bill for, whether that practitioner is employed by the LEA or contracted to provide services, meets the appropriate licensing and certification requirements. CMS approves specific practitioner types that are qualified service practitioners under LEA BOP. So it is important that when the LEA bills for services, they have confirmed that the practitioner who is providing those services indeed meets those requirements. You can find more information about the qualifications for practitioners employed by LEAs who may provide services in the Rendering Practitioner Qualifications section of the Provider Manual. Again, we will be providing links to these resources at the end of the presentation. In addition, LEA BOP providers must maintain records to disclose the nature and extent of services provided to Medi-Cal beneficiary. Essentially, this means that there is a level of specificity to the nature and extent of services provided to students enrolled in Medi-Cal. Practitioners are documenting the type of service provided and the scope of the service. So instead of documenting that a practitioner briefly talked to Johnny on January 31st, there would be details on what the discussion with Johnny entailed, any needed follow-up to be done, and the amount of time spent. Because there needs to be detailed information and documentation, records supporting the service must be made at or near the time the service was rendered. Finally, LEA providers must keep records for a minimum of 3 years from the cost report submission date and longer if an audit or review is in process or a cost report amendment is required. Let's quickly review the Medi-Cal eligibility ratio. The MER represents the percentage of an LEA's total enrolled students that are LEA BOP eligible and enrolled in Medi-Cal. The MER is included on the CRCS, which we will refer to as cost report in the presentation today. LEAs are required to identify total student enrollment on a snapshot date and to calculate the MER using October Medi-Cal eligibility data. As part of good practices in maintaining documentation, we want to reiterate the importance of maintaining the data that is used to calculate the LEA's MER. LEAs must keep the supporting files to document both the MER numerator and denominator. As a reminder, the total student enrollment file can be used to determine the denominator, and the output file is the basis for determining the numerator. Please note that since most LEAs have their billing vendor run the MER for them, it is the LEA's responsibility to maintain a copy of the MER calculation and the student enrollment file as it may be requested during an audit. And since you are dealing with highly sensitive information containing protected health information, it is very important that the data is securely stored. Now let's go over what is needed to bill LEA BOP. As noted in the eligible students section of the LEA BOP provider manual, the LEA must be enrolled as a Medi-Cal provider. Additionally, the student must be Medi-Cal enrolled and eligible to receive FFP. We are a federal program, so federal dollars are only drawn down for those who are eligible for FFP. The students must also be within the program target population. LEA eligible beneficiaries are students under age 22 who are Medicaid eligible beneficiaries, regardless of whether the student has an individualized education plan or individualized family service plan under the Individuals with Disabilities Education Act. Students with an individualized health and support plan or other care plan must be under the age of 21. Any person who becomes 22 years of age while participating in an IEP or IFSP may continue his or her participation in the program for the remainder of that current school year. Early and periodic screening, diagnostic, and treatment services are applicable to students under age 21. To provide LEA BOP covered services, proper authorization is required. Depending on the service type, this may take the form of a referral, recommendation, or prescription. We will be providing some examples of authorization requirements in the next few slides. Screenings can be based on the Bright Futures American Academy of Pediatrics recommendation for preventative pediatric health care, also known as the periodicity schedule or health screenings that are required for all students by the California Education Code or Health and Safety Code. For treatment services specifically, authorization must come from a qualified ordering, referring, or prescribing practitioner. Additionally, the service must be documented in the student's IEP, IFSP, IHSP, or other approved care plan. If the service requires supervision, such as when provided by a trained health care aide, documentation must also show that supervision occurred and met program requirements. Over the next few slides, you'll see tables that outline the types of authorizations required for both assessments and treatments. These tables also indicate which practitioners are qualified to provide the authorizations for each type of service. Please note that the information on these slides are detailed in the provider manual within each appropriate section. We'll begin with assessment services on the next two slides. In the left-hand column, you'll find the type of assessment. Following that, you'll see the type of authorization required, whether it's a recommendation, referral, or prescription, and the associated practitioners who are authorized to provide the authorization. Please note, in substitution of written authorization requirements outlined in the chart, a registered credentialed school nurse, teacher, or parent may also refer the student for an assessment. The referral must be documented into the student's file. Continuing on, we have additional assessment types listed here in this table, and the authorizations required for each one. You will see on this slide under vision assessments when mandated EPSDT vision screenings are conducted, the recommendations for preventive pediatric health care, known as the periodicity schedule published by the American Academy of Pediatrics, will act as the recommendation for the assessment. Moving on to the authorization for treatments, in the next two slides you will see tables of the treatment type listed within the left-hand column, followed by what type of authorization is required and which practitioners are authorized to provide the authorization. Building on that, we have additional treatment types listed here and the authorizations required for each one. Now we will move on to the documentation requirements with examples related to a direct service. We will be providing examples of what type of documentation will be required or what will be good to have in future sections that will tie this all together. So let's go over items needed to document a service at a minimum. You will need the date of the service, name of the student and the Medi-Cal ID number, the name of the agency that is providing the service. This could be the LEA name or the contractor's name, depending on which entity is providing the service, the name of the person providing the service, the nature and extent of the service, and the place of the service. Most of these are straightforward requirements other than the nature and extent component. So let's talk about how to document the nature and extent of the service in more detail. You may be wondering what is meant by documenting the nature and extent of a service. Documentation should be accurate, clear, and concise, and describe the service encounter in detail. Supporting documentation may include, but is not limited to, the items listed on the slide, depending on the type of service that is being documented. The items are progress and case notes, contact logs, nursing and health aid logs, specialized medical transportation trip and mileage logs when there's transportation being billed, assessment reports when assessments are being billed, date of service, name of recipient, Medicaid identification number, name of the provider agency, and person providing service. So how should services be described? Documentation must fully disclose the type and extent of services and answers questions such as what was done and why. This could be a reference to IEP, IFSP, IHSP goals or protocols or the care plan requirements. How much of the service was provided? For example, how much time was spent with the student? How many miles were transported? How much food or medication was administered? How is the student progressing, or did they respond to intervention? Context is important to explain the outcome of the encounter. Was any intervention or additional action taken or planned? Documenting the next steps is needed. It is the LEA's responsibility to maintain all of the following for all rendering practitioners: licenses, registrations, certifications, credentials, and whatever is needed for each practitioner type. We will include a link to the LEA Rendering Practitioner Qualifications section of the provider manual in the resource slides at the end of this training. Next slide. We briefly discussed parental consent for IDEA students when discussing what is needed to bill LEA BOP for a service. For IDEA students, you must provide written notification to the child's parent or guardian, which should be completed before obtaining one-time written consent and annually thereafter, and obtain a one-time written consent. Please note that parental consent may be revoked at any time. If this happens, any services provided after consent is revoked may not be billed to Medi-Cal. Billing for services is limited to on or after the date that the parental consent was provided. As a note, the notification requirements are codified in IDEA and published by the California Department of Education. Moving on to parental consent for non-IDEA students. For non-IDEA students, LEAs do not obtain consent to bill Medi-Cal for services. When a parent or guardian signs the Medi-Cal application, they are providing consent to bill for services. However, LEAs are bound by stringent Family Educational Rights and Privacy Act, also known as the FERPA requirements, and should check with their school district legal counsel to ensure that they are in compliance with FERPA prior to submitting claims to LEA BOP. Even though you may not need this consent to bill Medi-Cal, LEAs must still ensure that they are complying with FERPA regulations. CMS encourages LEAs to put a parental consent protocol in place for non-IDEA services. Let's move on to what documentation is associated with in the cost report. This table illustrates different checklists of documentation requirements for the cost report that LEAs are responsible to maintain. As a note, the cost report ensures that costs allocated to LEA BOP are calculated appropriately, adhere with general accepted accounting principles, and adhere with all applicable federal cost principles. On the left, documentation to support a MER, as we just discussed in the beginning of this section, are total student enrollment input and output files. Underneath are examples of supporting documentation that shows that the costs claimed were incurred by the LEA, such as payroll records, equipment purchase orders, etc. In the middle shows documentation components to support claiming for services for interim reimbursements as discussed in earlier slides. Finally, on the right, we have timed student source documents, including practitioner qualifications for TSP lists and random moment time survey source documentation, such as time study logs and Code 2A moment documentation, which will be discussed in more detail in a further section of this training. On this slide, you will see a couple of chat bubble icons, which indicates that we will be pausing for a first knowledge check. The question is, what is one of the elements that is required when documenting a service encounter? Here are the items that should be included when documenting a service. Date of service, name of student/Medicaid ID number, name of agency providing service, name of person providing service, place of service, nature, extent, or units of service. If you put any of these 6 items, you're correct. Well done. To wrap up section 1, I wanted to take a moment to touch on some key takeaways for documentation requirements. Documentation is essential to disclose the type and extent of services provided and to ensure compliance with federal and state requirements. LEAs must maintain records that support all services billed to LEA BOP, including practitioner qualifications and service details. Timeliness matters. Documentation should be completed at or near the time of service. Retention is critical. Records must be kept for at least 3 years from the cost report submission date, or longer if under audit. Now I will pass it off to Trung for section 2. Thank you.
Great, thank you, Dana. We will now move on to the next sections, which is authorization requirements for LEA BOP services. So LEAs are required to include the NPI numbers of the ORP practitioners on claims for treatment services. In addition, ORP practitioners who order, refer, or prescribe treatment services in the LEA BOP must individually enroll as a Medi-Cal ORP providers. This is outlined in the provider guide sections of the LEA provider manuals. For qualifications, this requirement does not apply to assessment services. The table here illustrates which qualified ORP practitioners for each treatment service type are covered in the LEA BOP, effective as of July 1st, 2018. For nursing treatment services, as far as medications and therapeutic administrations, the ORP would be a licensed clinical psychologist, dentist, physicians, or podiatrist. For specialized physical health care and other nursing health services, the ORP would be a physician. For occupational therapy and physical therapy, the ORP would be a physician or podiatrist. For psychology counseling treatment services, the ORP would be a licensed clinical social workers, licensed educational psychologist, licensed marriage and family therapist, licensed psychologist, physicians, or registered credentialed school nurse. For school health aid treatment services, the ORP would be a physician. And for speech, language, and audiology treatment services, the ORP would be a dentist or a physician. LEA BOP providers will need authorization for direct medical treatment services, which may be signed by a PA or an NP, as appropriate in place of an authorization signed by a physician. The PA or NP who signed the order may be employed or contracted by the LEA or may be the student beneficiary primary care providers. In addition, when submitting claims or treatment services ordered by a qualified PA or NP, LEA BOP provider must ensure that they comply with the ORP provider policy, as stated in the Physicians Billables Procedures section of the LEA provider manuals. Authorization can also be provided by contracted physicians. In this case, the physician does not need to see the student to authorize the service. They may instead conduct a review of the student records. If your LEA hires a physician or authorized services, the physician should have a working relationship with the LEA and be a treating practitioner. Authorizations for assessment should be in writing and include in the school names, the student's name, the observation noted, and the reason for assessments. If a practitioner provides the authorizations, the practitioner titles and signature should be on the written authorizations. If the parents provide a verbal request for assessments, the practitioner can document this information in the student file so that there is a written authorization on file. Screening must be authorized by periodicity schedules. This table is an example of the American Academy of Pediatrics, which referred to it as the Bright Futures Periodicity Schedules. It covers all sorts of screening and goes to the age of 21. This is an example of periodicity table for physical examinations scheduled for ages from 11 to 21. This schedule is available on the American Academy of Pediatrics website, and we will provide you with the link towards the end of the presentations. The X marks in the table indicate the specific age at which a physical exam is recommended. These guidelines help ensure that screening are done at appropriate developmental stages. As mentioned previously per SPA's guidance, screening may be based on the Bright Futures AAP recommendations for preventative pediatric healthcare or screening or health screening that are required for all students by the California Education Code or Health and Safety Code. Additionally, it is important to note that the type of treatment service will determine whether a referral, recommendations, or prescription is required. We will explore these distinctions further in the next slide. All LEA BOP treatments require a prior authorization by an ORP practitioner. The type of treatment service will dictate whether a prescriptions, referrals, or recommendation is required. State and federal law requires treatment to be authorized. Prescriptions are the most formal type of authorizations and are required for nursing, occupational therapy, and physical therapy services. Referrals are less formal than the prescriptions and are required for speech and audiology services. Recommendations can be in the form of notes in the student's files and are required for psychology and counseling services. Authorizations must be updated annually and is valid for 1 year from the date of order. Authorization cannot be retroactively applied to services rendered without the authorizations in place. In addition to being authorized by an ORP provider, all treatments must be outlined in an IEP, IFSP, or IHSP, which may have a different name depending on the LEA. Written authorizations for treatments must include the components are listed here. School names, student's name, practitioner's observation and reasons for treatments, and the signatures and title of the authorization licensed practitioners. Just a reminder that parents or teacher cannot authorize treatment services. Authorizations for treatment services must be provided by qualified licensed practitioners within the scope of practice. The authorizations for treatment services can be documented in the IEP, IFSP, or IHSP, or other type of care plans. This should include documentation of the type of service, number of frequent services, and length of treatments as necessary. Let's go over the documentation requirement for specialized medical transportation services. In order for these services to be reimbursable under LEA BOP, 3 conditions must be met. The transportation must be provided in an approved vehicles such as liter van, wheelchairs van, or specially adapted vehicle. The service must be authorized in the student IEP or IFSP. Transportation can only be billed for students with an IEP or IFSP. And lastly, a covered LEA BOP service must be provided on the same day. To support a transportation claim, documentations must include the student informations, the date of transportations, verification that the student was in school and received a cover service that day, and documentations of all transportation costs claimed on the cost reports. Additionally, if mileage is being claimed, documentation must also include the originations and destination points, and also the total numbers of miles traveled. The transportation billing can be found on our website in the program manuals and compliance information sections. We will also provide a link at the end of our presentation today for your reference. TCM services assist eligible children in accessing needing medical, socials, educational, and other services when TCM is covered by the student's IEP, IFSP, or IHSP. The required documentation for TCM includes care plans, maybe refer us to a service plan, records of TCM activities, records of students and or family progress, assessment reports, and lastly, the TCM certifications. New policy effective July 1st of 2020, LEA who seek reimbursement for TCM services rendered through an interim reimbursements and final settlements must complete a TCM certification statement and identify TCM practitioners, appropriately in the time survey participants or TSP list. Please reference the PPL 20.033 reinstatement of TCM and the targeted case management section of the LEA provider manual for more guidance. Please note that we are still working on the new PPL with new guidelines for how to complete the TCM certifications, which will be out soon. As you see on the slides, a couple chat bubble icons indicating that we will be pausing for our second knowledge check before moving on to the next topic. Questions. Which of the following services require authorization from an ORP practitioners enrolled in Medi-Cal? A. Assessments. B. Screenings. C. Treatment services. Or D. Specialized medical transportations. So the correct answer is C. Treatment services. Treatment services must be authorized by a qualified ORP practitioner whose NPI is included on the claim and who is individually enrolled as a Medi-Cal ORP providers. As stated earlier in the training, documentation of services is required, including authorization of the service. The authorizations requirement differ based on the type of services. For assessments, authorizations may come from a parent, teacher, or practitioner within the scope of practice. For screenings, the authorizations is the periodicity schedule which provide guidance on age-appropriate healthcare services. For treatments, services must be authorized in the care plans, including an IEP, IFSP, or IHSP, including a 504 plan or nursing plan. For specialized medical transportations, the service must authorize in the student IEP or IFSP. And for TCM, the services must be authorized in the student IEP, IFSP, or IHSP. All authorizations should be maintained in the student files and available for state federal reviews. If the periodicity schedule is used to authorize this service, this does not need to be maintained in each student file, but instead can be maintained in the LEA central files. We recommend that you put a new periodicity schedule in your folders for each fiscal years because sometimes the recommended services or interval change. Some services, such as those provided by trained healthcare aides, require supervision by a licensed practitioners. In this case, documentation must clearly show that supervisions occur and met the standard outlined in the LEA provider manuals. For more information on who can authorize services, please see the Program Administration's checklist on meeting the basic administration and management requirement of the LEA BOP. I will now hand it over to Lolani for our next topic.
Thank you, Chung. In this section, we will be covering Code 2A documentation requirements. Just as a brief refresher for anyone who may be new to the program or new to RMTS, since July 1st, 2020, the LEA BOP has used the RMTS as a component of the cost settlement reimbursement methodology. RMTS is a statistically valid means of determining what portion of a group of participants' workload is spent performing Medicaid reimbursable activities. Under RMTS, the LEA identifies rendering direct service practitioners who are qualified to provide school-based services. These practitioners who participate in RMTS are called TSPs and are in Participant Pool 1 for LEA BOP as they perform direct medical services. Every RMTS quarter, these TSPs are randomly selected and asked what they are doing during their assigned moment, which is a duration of 1 minute. Not all TSPs on the LEA list will get an RMTS moment. An RMTS moment reflects how LEA's employees' time is distributed across a range of activities and estimates how time is allocated across the universe of TSPs. These moments are then coded into one of 18 codes. For direct medical services under LEA BOP, If an employee is providing a direct medical service, it would fall under Activity Code 2. Why is RMTS important? RMTS plays a role in LEA BOP's cost reconciliation process. It is a part of the funding and payment methodology to allocate costs to the LEA provider through the cost report. The RMTS is used to determine the time that practitioners spend on direct medical services, general administrative time, and all other activities to account for 100% of time. The direct medical services percentage, also known as DMSP, is derived from the results for direct medical service practitioners providing covered direct medical services and is added to the cost report. It is important that all of these moments have documentation so that the LEA can receive and keep the funding for covered services provided to students. Now, how does the RMTS matter for documentation? One of the requirements to ensure eligible FFP through the LEA BOP is documentation. If an LEA does not have supporting documentation for Code 2A moments, they may not be able to show that the moment is eligible for FFP, which leads to its impact on the DMSP on the cost report, and the possibility for a negative financial impact. For example, if a federal audit occurs and the LEA does not have supporting documentation for those 2A moments, their claims associated with that service category or practitioner may be disallowed. Direct medical services under Code 2 are further classified into two subcodes. Code 2A is used when the moment response describes an LEA BOP covered service. This includes assessments, screenings, including EPSDT, direct medical treatment services, specialized medical transportation, extensions of a covered direct service, and TCM services only if the TSP has been identified as billing through TCM through the LEA BOP in the TSP list. If the activity of a random moment falls under the definition of a billable service, a Code 2A can be assigned regardless of whether the service ends up being billed through the LEA BOP. For example, providing speech therapy to a student not enrolled in Medi-Cal is acceptable to be coded as a Code 2A, even though that service would not be billed to LEA BOP because the student does not have Medi-Cal coverage. Code 2Z is appropriate for moment responses describing direct services or an extension of a direct medical service that are not covered under the LEA BOP. For example, a practitioner that is tending to an ill staff member during their assigned moment. This would be coded as a 2Z. In this case, the activity is a medical service but is not reimbursable under LEA BOP. Code 2A may be assigned when a moment response describes an activity that is an integral part of a direct medical service or an extension of a direct service. For example, following up with a patient after a direct service is conducted would be considered an extension of the medical service. Code 2A will also include pre- and post-time directly related to providing direct care services when the student is not present, such as time to complete all paperwork related to the specific direct care service. Some examples of pre- or post-service time include patient follow-up, patient counseling, such as planning activities for an upcoming patient therapy session, patient assessment, including reviewing evaluation test results or observing a student as a component of the assessment process, patient education, parent consultations, completion of billing activities, and any related paperwork, clerical activities, or staff travel required to perform covered service activities. This can include preparation of progress notes and session notes after a session, or travel to and from a treatment session. It's important to understand why Code 2A documentation is necessary to maintain. As mentioned earlier, the RMTS is a part of the payment methodology in the LEA BOP. Code 2A moments are the main component in the calculation of the DMSP, which is one of several allocation factors that is used to calculate allowable costs on the cost report. As mentioned earlier, the DMSP determines the portion of time that the practitioners in the RMTS region provided LEA BOP allowable services. The cost report is the mechanism that compares an LEA's cost to the reimbursement and calculates the federal funds for LEA BOP services. Because the DMSP is a significant allocation factor to determine allowable costs, CMS requires LEAs to produce, maintain, and furnish documentation to aid in any financial management review or audit so that they can provide evidence that supports that the moment response was a covered direct medical service activity. Please note that if federal auditors note that the source documents do not support the moment coding, the federal auditor can recommend recovery of federal funds. Proper documentation ensures your LEA receives the funding it deserves. We'll be providing some examples of 2A moments and what documents might be required to support those moments in later slides. Let's go over some direct service documentation that can be used to support a moment. Please note that these are examples of what could be provided. This isn't a requirement to produce all to support one moment. School attendance records for the date of the claim. This can serve as proof that the student was present at the time of the service. Practitioner licenses or certifications as required. This is proof that the practitioner who provided the service is qualified to do so. Student medical records to provide the student medical history and what services they need. Payroll records are needed for personnel furnishing services and for audit purposes. Copy of the claim submitted to Medicaid. This shows as proof that claims have been submitted. Documentation of the service on the date claimed, such as progress notes, logs, start and end times, etc., to serve as backup documentation in case of an audit. Contracts with medical providers to bill for contractor services and proof for authorization. IEP or IFSP or care plans such as IHSP to support the service. This is a required document to bill for LEA BOP services. Authorization for services to obtain to provide treatment, screenings, and assessments. And finally, documentation of where the service was provided and who provided the service to make sure direct service was provided by a qualified practitioner. With reference to the CMS Medicaid SBS Federal Documentation Requirement Guide, here are some examples of supporting documentation for 2A moments that LEAs may have. The student's IEP or IFSP, prescriptions, referrals, or recommendations for IEP services, the student's IHSP or other type of care plan used as a medical management tool for providing medically necessary services to a student in a school setting, assessment reports, treatment logs, the student's medical records, and medical provider qualifications associated with licensing and certification of the provider. It is important to have documents available that can support your Code 2A moments. That doesn't mean you need to have everything listed here, but DHCS suggests that you have one or more pieces of information to support Code 2A moments. Here are more examples from CMS of supporting documentation for 2A moments that LEAs may have. Billing schedules and/or documents, practitioner schedules, calendars, timesheets, and student attendance logs when the moment indicates that the TSP was with the student. It is important to have documents available that can support your Code 2A moments. We will provide you with some examples of 2A moment responses with supporting documentation later in this presentation. A link to the CMS Medicaid SBS Federal Documentation Requirement Guide is also provided at the end of this presentation that contains more examples of additional supplemental documentation to support these moments. As you can see on this slide, there are once again a couple chat bubble icons, indicating we'll be doing a quick knowledge check of what you have learned during this section. The question is, what are some examples of documentation that can be provided to support Code 2A moments? As we learned from the previous slides, here are some examples of supporting documentation for 2A moments that LEAs may have. The student's IEP, IFSP, IHSP, or other care plan, billing schedules and/or documents, student attendance logs, practitioner schedules, assessment reports, treatment logs, and much more. Additional examples of supporting Code 2A documentation can be found in CMS Medicaid SBS Federal Documentation Requirement Guide, which the link will be provided at the end of this presentation. As a reminder, it is important to have documents available that can support your Code 2A moments. We will provide examples of these situations in later slides. To wrap up this section, here are some key takeaways related to Code 2A moment documentation. First, LEAs should submit interim claims for direct services that are eligible for reimbursement. This will assist LEAs in documenting moments because in order to be billed, the service would have met documentation requirements for a covered direct service. Interim billing documentation and retention standards should align with RMTS documentation requirements. Even if a student is not Medi-Cal eligible, participants are still instructed to maintain documentation for audit purposes. Second, be thoughtful about producing a quality TSP list, not a quantity TSP list. This can help to boost the proportion of moments coded as 2A. Lastly, LEA BOP coordinators should be reviewing the moments that are coded to 2A and ensure that they have appropriate supporting documentation for these moments. This may mean that coordinators follow up with TSPs to gather documentation and build a supporting audit file. It is important that as soon as the TSP has been notified for the moment, that the LEA gathers the documentation as close to the moment as response as possible. I will now pass it over to Sherry for the next section.
Thank you, Leilani. As mentioned in Section 3, we are now going to be providing documentation examples that relate to Code 2A moments. The goal of documentation is to prove the details of the moment and how they connect to a direct service. It is important to provide as much detail as you can when responding to moments. We will be differentiating on what documents are needed for a moment and what is good to have. Please note that it is a good practice to keep a student's IEP, IFSP, and/or assessment reports at all times when billing for 2A moments. Before we get into the moment examples, we want to provide a brief overview of general documentation requirements versus 2A moments. On this slide, they are broken into two separate columns. General documentation is where LEAs must maintain records to support services billed to LEA BOP, which may include payroll records for personnel furnishing services, documentation supporting interim claims, documentation of the service, for example, progress notes, logs, start and end times, IEP, IFSP, IHSP, or other care plans, authorization for services, and RMTS source documents. 2A moment documentation is what is needed for RMTS and what is needed to support what happens specifically in the moment and may include IEP, IFSP, IHSP, or other care plans, documentation of the service, for example, progress notes, logs, start and end times, assessment reports, and treatment logs. Billing schedules and/or documents are recommended. Practitioner calendar schedules, timesheets are all recommended as well, and student attendance logs are also recommended. Here we have an example of direct service documentation for a physical therapist that received a moment. First, the TSP is always asked the pre-question, was this activity related to an assessment or screening or related to a service that is authorized in an IEP, IFSP, or other service care plan? For this moment, the TSP answered yes. They were then asked, who were you with? And they answered that they were with a student. What were you doing? The TSP answered that they were in a therapy session with the student. And why were you doing this? The TSP was performing the therapy session as the student's IEP requires physical therapy services twice a week. Since the TSP is providing a direct service to the student with an IEP, this qualifies as a 2A moment. To support this particular 2A moment, here are some examples of possible documentation that the TSP can maintain when audited. the student's IEP, which would be needed since the IEP was mentioned in the moment response. In general, if an IEP is mentioned in the moment response, then the IEP would be needed as supporting documentation for the moment. TSP's calendar showing they were in a therapy session during the assigned moment. This would be good to have, but is not necessarily required for this particular moment. Progress notes with date of service and detail of session. The attendance records that support the student was at school on the day of the moment. There could also be other items that substantiate the response, but these 4 examples would provide support for this moment. And next we have an example of direct service documentation for a credentialed school psychologist. In response to the pre-question, the TSP answered yes. Then they were asked, who were you with? They answered that they were with a student. In response to what were you doing? The TSP answered that they were assessing a student. And why were you doing this? The student was referred for a triennial evaluation, and the TSP was assessing them to start the evaluation. To support this particular 2A moment, examples of possible documentation include the student's IEP, which can be used to support the triennial assessment timeline, the resulting assessment and/or report for the IEP team, attendance records showing that the student was at school on the date of the moment. And next we have an example for a documentation for a credentialed school psychologist. And once again, the TSP answered yes in response to the pre-question. And who were you with? They answered they were alone. What were you doing? The TSP answered they were writing a report. And why were you doing this? The TSP was summarizing assessment results in preparation for an upcoming IEP meeting. This is an extension of the direct medical service, in this case, the assessment. So to support this 2A moment, here are some examples of indirect documentation that the TSP can maintain. The student's assessment and resulting report, the student's IEP, and please note if an IEP wasn't established, you would need some sort of documentation to support that the IEP was not yet established or never established. In this case, the calendar entry would be needed to establish that this is what was being worked on at the time. And here is a final example of an extension of a direct service documentation for a licensed physical therapist. The TSP answered yes again to the pre-question in this case. And then when asked who they were with, they answered no one. What were you doing? The TSP answered they were preparing for an activity, or excuse me, they were preparing an activity for an upcoming therapy session. Why were you doing this? The student's IEP requires therapy twice a week. This is a 2A moment, as this code also includes pre and post time directly related to providing direct care services when the student is not present. These include time to complete all paperwork related to the specific direct care service, preparation of progress notes and session notes, review of evaluation testing, observation, planning activities for the patient therapy session, travel to and from the treatment session, or completion of billing activities. So in this case, it is an example of a pre-service activity. To support this particular 2A moment, some examples of an indirect documentation that the TSP can maintain when audited include progress and session notes of the session on the date of the moment, and the student's IEP that indicates they are assigned therapy twice a week. And as you can see on the slide, there are once again a couple of chat bubble icons indicating that we will be pausing once again for a quick knowledge check. So there's a question here on the slide. A school psychologist receives a moment while writing a report alone to summarize assessment results. What are some ideas for documentation that could support this code 2A moment? And on this slide, you will see some correct answers. This moment is an extension of the direct medical service, so in this case, the assessment. To support this 2A moment, here are some examples of indirect documentation that the TSP can maintain. The student's assessment and resulting report, the student's IEP or documentation that the IEP was not yet established, calendar entries, and this would be especially important if the IEP had not yet been established, to show that this is what the TSP was working on at the time. Okay, so as we wrap up section 4, we'd just like to go over a few key takeaways. So first, thorough documentation is essential. Proper documentation ensures that your LEA receives the funding for covered services that are already being provided to your students. For Code 2A moments, whether it's a direct or indirect service, the documentation should clearly support the activity described in the moment. This includes IEPs, assessment reports, and treatment logs, especially if they're referenced in the moment response. And finally, more documentation equals stronger audit readiness. Recommended documentation such as billing schedules and/or documents, practitioner schedules or calendars, timesheets, and attendance logs can further support the moment and reinforce your audit preparedness. And please note that some of those items may actually be required depending on the moment. Great, and now on to section 5, helpful resources. And so for additional information on documentation requirements, please see the LEA BOP Provider Manual. For more information on RMTS and Code 2, please see the SMA Manual. And you can also reach out to DHCS with any questions at the inboxes listed here on this slide. And if the question is specific to RMTS or Code 2A, feel free to direct back to the RMTS inbox. And if your question is about documentation in general, you can send that to the LEA BOP inbox. And these next 2 slides just provide several links to the resources that we talked about today in this presentation. As a reminder, if we weren't able to get to your questions today, please feel free to email them over to the LEA inbox shown here on this slide. And this concludes our general and Code 2A documentation training. On behalf of the LEA BOP, I would like to say thank you. We appreciate your time and your attendance today. And your feedback is important and it informs how we develop future trainings. So if you could please be sure to take a moment to complete our feedback survey, that would be much appreciated. And you can use the QR code on the screen, or we'll also drop the link in the chat to submit your thoughts regarding today's training. And thank you all again so much, and I hope you have a wonderful rest of your afternoon.